Hello. This video is going to be me administering an IV medication via mini bag. First thing I'm going to do is refer to my physician's orders here, and I am going to verify that we have the correct medication, correct dose, route, and frequency of administration, and assess appropriate lab values and history of allergies. The physician's order is Rosefin 1 gram IV daily as directed over 30 minutes. Available is 500 milligrams per milliliter. And we're going to, after we figure this out, the math here, it's 2 milliliters at 17 drops per minute. My math calculation is here. Safe doses of Rosefin is 1 to 2 grams once daily. It binds to bacterial cell wall, causing cell death. Cephalosporin 3rd generation. It's for the treatment of UTI, skin infection, and respiratory infection. Side effects include GI upset and fever. Contraindications are if allergic to penicillin, cephalosporin, can't hang with calcium IV, hepatic renal disease, anaphylactic pregnancy, or breastfeeding. The labs that need to be assessed is liver and kidney function, AST and ALTs. There should be a BUN of 7 to 23 and creatinine of 0.6 to 1.2. The next thing that I need to do is going to be assemble my medication solution and everything. So I have my medication here, right? Okay, let's not get sidetracked here. So first thing I need to do, we said we were putting in, back to this doctor's order, this math, we're looking for 2 mLs of Rosefin. So here I have my Rosefin, and staying aseptic. I'm going to wipe the top of it. 2 mLs, we say. So I take this off, draw back 2 mLs of air, put it into my bottle, push, pull back my 2 mLs of Rosefin. Okay. Next thing that I need to do is I need to put my Rosefin into my IV solution here. I need to clean it first. It's always a good idea. Cleaning. Anytime you connect any type of port or touch anything, you want to clean it. Clean it. Alright, so here I come in, put in my 2 mLs of Rosefin. Right, and I'm going to cap this, and this is going to go off into the sharps bin. I'm going to reuse a needle. The next thing that I'm going to do is take my medication label here, and I'm going to put down the patient's name, what's in this bag, and the date and time that I'm doing it, and who I am. So this is going to be on the bag. I'm not going to leave it there because we have one to share here. So. Put that back down, and we'll just assume that that's on the bag right now. The next thing I need to do is attach my needleless device to the bag and get it set up for priming. So we rip this open. This is our tubing, and we pull it apart here, right? And take off our little blue cap here and stick this in here. All right. Now, what priming this means is, what priming this means is we're going to get all the air bubbles out of here. So what I'm going to do is hold this at a lower point than my bag. I have a trash can back here that you can't see. And I'm going to let this run. There it is. And it's dripping. Let's close it off. Looks like all my air bubbles are out. We're good there. Now, the next thing that I need to do is this is going to be a new needle here, and I have some sterile water fluid here, and I am going to flush. Well, I'm going to drop 6 milliliters. Huh? Thank you. 6 mLs of air into my water saline. I'm going to withdraw my 6 mLs. So now I have a syringe here with 6 mLs of saline. All right, we got that. We're going to dispose of the needle in the sharps, right? Okay. Now that I've done that, I am going to actually make contact with my client now. Everything should have been set up. We walk in, we're good, everything's where it's at, and I'm going to talk to this guy. I'm going to take the piece of tape here, and I'm going to label my tubing also, so we know that I did it, at what time I did it, and when this was all set up. Now at this point, I'm going to make contact with my patient. Hey, Mr. Sir, we're going to be setting up this line to your existing IV catheter, and we're going to be giving you some Rocephin. Doctor's orders. Do you have any questions? He understands. We're good. Moving forward, I am going to assess the existing line for patency, and before I do this, I need to wash my hands. Aseptic technique, right? Let's not forget. I have my gloves. I'm putting on my gloves. We're good. That slide right on. All right. So now that I have my gloves, I'm inspecting the site here. I'm looking at it. It looks good. I'm touching it. There's no tenderness, no pain, nothing going on there. So before I flush this, to keep this aseptic technique, right, we're going to take this alcohol swab. I'm going to swab here, right, and I'm going to have my syringe here of saline. I'm going to swab that. I'm going to connect it. And first I'm going to pull back. See, we're getting some red there, so there is a return. And now 1/2 ml at a time, push-stop method. I am going to administer 3 mLs of this fluid to make sure we have a nice solid path of fluid flow here. So half, stop, half, stop, half, stop, half, stop. Maintain my positive pressure. I'm now going to clamp this tube. I can disconnect this, cap it off. Good there. All right, now that I have established that we have a good line here, that everything runs, I can get to my actual medication administration. Again, before we access any ports, aseptic technique, right? We need alcohol swabs. I'm going to hit this port, get it good. Hit this port, get it good. Now I've primed it so there's no air bubbles in here, right? So we're good. I'm going to hook this up. I'm going to set my machine. We want 17 drops per minute. We went over this earlier. 2 mLs I'm going to administer. I will undo my clamp. And that's all for this part. I am going to walk away. I'm coming back to check on my patient, and this med bag is all gone. It's all been administered. Everything's good. It's looking good. So what we do at this point is we clamp this off again. Shoot, before I come in, I would have changed my gloves. I would have been gone, washed my hands. I'm coming back in. My hands are clean for a whole new thing here, and I've re-gloved. Okay, now I'm going to check the med. The med's gone. We're good. He got what he was supposed to get in the right amount of time. I'm going to unclamp this. I'm going to disconnect this. Maybe. Okay. So, and now what I'm going to do is I have 3 mLs left in this of the saline solution here. And now what the point of this is I'm going to finish flushing the medications into your screen off. I'm going to finish flushing the medications in to make sure that this tube stays clear. Push stop again. Got 3 mLs. I'm going to go half, stop, half, stop, half, stop, half, stop. I don't know if I did or not, but I would have wiped those first. Clamp this back off. And I'm going to make sure, I kind of did it while I was going through it, but I'm always going to make sure that all of my sharps always go into the sharps container. Huge, huge foul. If the doctor has ordered heparin, this would be a good time to administer the heparin. This doctor has not ordered for heparin, so no need for that. So I'm going to clean up, like I say, syringes, sharps, gloves off, check the P's, make sure he's good, he got his medicine, he feels good, the bed's where he wants it, he's got his possessions, he's good to go, and now I am off to document. When I go to document, what I am going to do is head to the MAR, and in the MAR I am going to record the time, dose, and route, and also state the condition of the IV site that I've inspected, that it, that it looks good, it wasn't tender, no infection, and that everything looks good. And we're also going to want to remember the amounts of fluids that we've put in so we can keep up with our I's and O's.